As India marches toward the vision of Viksit Bharat by 2047, preventive health has emerged as a crucial pillar in transforming our healthcare landscape. With rising lifestyle diseases, growing health awareness, and an overburdened curative system, the need to shift focus from treatment to prevention has never been more urgent. And today with me on this panel to discuss this very important issue, we're joined by Dr. Chandrakant Laharia, expert health systems and public policy. Nutritionist Ishi Khosla, Dr. Ashwini Setia, gastroenterologist, Ravi Bhatnagar, Director, Corporate Communications and Corporate Affairs, South Asia, MENARP and Africa, RECIT. Thank you so much all for joining us, and a round of applause for our panel, please. Dr. Laharia, I'd like to start with you when we talk about, preventive health and creating awareness. If you could tell us a little bit about what this is exactly, and also how do we make it more popular in the underserved areas? Because I think in urban areas there is perhaps more awareness regarding this, but we need to take it to every corner of the country.
Thank you very much. And Gagiji, I would like to say special thanks to you because you said preventive health. Prevention is often a word which is very loosely used, and that's why it is insufficiently understood. So when we are talking about health or medicine, we should use the term preventive medicine or preventive health. Now, preventive health or prevention is something which prevent things which have not yet happened. And that's why preventive health is always underrated or underestimated. Curative or treatment is something which gives an immediate result or instant results. That's why treatment is always overrated or overestimated. Now, when we talk about holistic health and you were talking about 5 pillars, it's important that as a society or as a community, we start thinking of giving equal weightage or giving a due weightage to the prevention, promotion, curative treatment, because all 3 are equal pillars. So I always talk and discuss that prevention, promotion, and prompt treatment are 3 pillars which should be given a due weightage. In fact, if we follow prevention, we can avoid a lot of disease burden. In this context, we know that because this is an era or time of instant gratification, something which will give outcome in the longer run, we really do not give a value. So that's why prevention need to be given more weightage. And more very specific example can come from COVID-19 pandemic period. We know that during the COVID-19 pandemic period, when people were asked to wash hands or wear masks, they were not doing so because the benefit was not immediate. But when the disease started spreading, especially in the first and second wave, the preventive approach were adopted. Now, in India, majority of programs and majority of interventions follow prevention as a component. But I would say that even a patient or individual or family are not still adept that prevention is followed. They believe that if you let me put this point here,
sure,
that there are non-communicable diseases which are rising, and every non-communicable disease, diabetes, hypertension, heart disease, require an essential component of halting those diseases are prevention. But what is the prevention? Prevention is a healthy diet, physical activity, exercise. And now people believe that, I have to go for a gym or exercise every single day for the rest of my life. That is too much to be done. And that's why they think if I fall sick, or people do not wear masks when there is a disease spreading, they think if I fall sick, I'll get treatment. But I think that is a wrong approach. We are living in an era where diabetes, hypertension, cholesterol disorders are rising. If we do not follow preventive approach, it will result in increased burden on hospital. It will increase the cost of healthcare. A healthy nation cannot happen only by the hospitals. It requires preventive approach, and that's why we need to pay more attention. I'll come back to other aspects later.
All right, Dr. Laharia, and yes, I think that old adage, prevention is better than the cure, has never been more true than, today. Ishi Khosla, we're talking about preventive care, and there have been campaigns around fitness, health, mental health as well. Do you think these are enough? Are they, getting the right, are they, they're targeting the young people? Are they getting that message across?
First of all, thank you for having me here. And, Gargi, I feel, and I was just discussing it with my panelist over coffee, that there is no dearth of information today.
Yes.
I think we, as a generation, are far more equipped with information, knowledge about food, about diet, about nutrition, compared to our parents, our grandparents, and our great-grandparents. There's so much conversation around food. There is so much information on when you buy food. There is it was never before. We have calories, proteins, carbohydrates, everything listed out there. We have equipment when we're exercising. We have apps. We have everything today which was never there. But it's not adding up to good health. It is really, on the contrary, we are in a state of health crisis. And whether it's mental health, whether it's physical health, and the generations ahead. In fact, I'm going to quote from a Yale public health expert who has said the coming generation of children is going to have a shorter lifespan compared to their parents.
Which is so shocking because we'd expect the opposite.
It has never happened in the evolutionary history of mankind. So something is clearly not fitting in. That its information is, it's not lacking, but we are probably not making striking the right chords. And I'm also going to quote from Dr. Mark Hyman, who's a functional medicine expert. And he says, and I think that will sum it up very beautifully, that today we are being fed by a food industry which is not paying attention to health, and being treated by a health industry which is not paying attention to food. And I think this is where we need to understand that food has changed drastically over the last 3 decades. It's really, with the advent of the food industry, we are being fed by an industry which has many, many issues. There are chemical additives, there are processing issues, and the safety of food is certainly questionable. And what I would say is today we are getting fake food. And when I say fake food, we are wanting to take protein supplements rather than increasing 2 eggs or just increasing something more in your diet. We are being fed and being brainwashed that we are inadequate in certain nutrients, and we're just offering, the examples can continue. We are being given margarine in the garb of health food, which is actually artery clogging. And I can list 10 examples. I won't take up that kind of time. But sure. I'm just trying to tell you that we need to change our ecosystem and with respect to our food. To say that our children are not literate, our children are literate and smart and wanting to change. Everybody here is aware of good food and what is not good food. But why is it that it's not adding up? Because there are reasons for it. I'll just give you another example when it comes to managing your food. Food is becoming addictive. The food technology industry is putting billions of dollars to making food addictive. So we are not able to control our cravings. We know that this, say, sugar is bad for us, but what do? We're not able to handle it. So net, I think we need to focus beyond just having campaigns and just having messages and information. We need to understand that the food industry needs to be guided and to be also through policy managed.
All right.
Yes, and not to use trans fats, not to use chemical additives, not to use, and there are.
So there is more awareness now regarding what is going into you and what ingredients are in our products, but it needs to be more widespread. I think
it needs to be legislated.
Policy as well. We do know trans fats. There has been a lot of policy change, regarding that, but
using the right grains, using millets, using rice,
and we have the millet mission as well, pushed by the Prime Minister. Dr. Ashwini Setia, that brings me to you. We're talking about lifestyle diseases, and of course, Dr. Laheria, you would know about the ticking time bomb, that is diabetes. That's another lifestyle disease that is increasing in the country as people are consuming more and more processed food. But tell us a bit about taking from there to create awareness. We have fatty liver that has nothing to do with alcohol. It's more to do with the kind of products that are being consumed, as Ishi Khosla said. And there's also environmental factors. There's a lot of plastics in our food right now as well.
Right. Thank you very much, Gargi, for having me on this show, and good morning to everybody. I'll take up from where Dr. Laheria mentioned. As far as the community part is concerned, there is a paradigm shift in what the community health was there, say, around 40, 50 years ago and what it is today. Earlier on, we used to focus on clean potable water, etc., because it was waterborne disease and vector-borne disease, etc. Now, the non-communicable diseases, that is the lifestyle diseases, also spreading in the rural areas in our villages because of the industry, because of so many other things. The industry is sponsoring so many things and advertising it so vociferously that the convenience foods are available there for everybody to pick up. And these convenience foods are playing havoc with our health. Just to give you an anecdotal example, the inflammatory bowel disease, that is ulcerative colitis and Crohn's disease, has paralleled the advent of fast food in this country. When I was doing my specialization about 45 years ago, at that time, we used to struggle to find one case of inflammatory bowel disease in the whole month or a whole year. Now, in every single month, we are having increased incidence of this. So that is because of the highly processed food. The high sucrose corn syrup is being used in cold drinks, and that is playing havoc with the health in terms of giving more sugar load. And you'll be surprised to know that fatty liver as such has got nothing much to do with the fat intake. It has got everything to do with the sugar intake. Right? And in fact, the sugar is number one villain today.
And yes, we hear this more and more these days, yes.
Yes. So as far as fatty liver is concerned, it will not be an exaggeration to say that it is an epidemic. Although the results of various research figures, they show that it's about 30 to 40% of all ultrasounds that are being done will have fatty liver as an incidental finding. My own experience is that it is more than 80%. Right? So everybody is having that fatty liver. And what they do not understand is that this is an incidental detection because there are hardly any symptoms which will bring the patient to the doctor. And therefore, you are getting the ultrasound done for some other reason and you pick that fatty liver up. Problem is that it is insidiously progressive disease because it causes inflammation in the liver and then it kind of proceeds on to become fibrosis and cirrhosis and further, in some cases, may also have hepatocellular carcinoma.
And people are landing up in hospital for this treatment, and you're saying this could be prevented had they taken care earlier, and we need to create that awareness
that,
regarding...
So I would suggest that in case the message goes loud and clear, that sugar must be avoided.
All right. That's something for policy, and that would be something that not many of our corporates perhaps would be happy about. But as you say, it's something that needs to be done. We have to take the bull by the horns and prevent. It's going to build up over the next decade, next couple of years.
See, the corporate and the food industry and the pharmaceutical industry is not going to like what I'm going to say.
Do say it. Yes.
So, see, the thing is, they have to self-regulate. Today, they are fooling people by saying this is healthy food. For example, I'll give you a small example of baked beans. Packed baked beans are there, that it is very healthy food and so on. In 400 gram tin of baked beans, there is 20 gram of sugar and so much high salt as preservative.
So I don't know if baked beans are that popular, fortunately, yet in India. I don't think they are. But Ravi, this brings me to
I just gave you an example.
Yes, of course. We're talking about messaging and getting that messaging right. And I'll come to you, Ishi. Tell us a bit about what corporates can do. What can we do at the school level? Reckitt has done so many, campaigns. They've been appreciated regarding, health and preventive health as well. So how can we get more corporates? What can we teach at the school level regarding this?
Thank you, Gargi, for having me here. And a beautiful partnership with NDTV from a decade almost now,
yes,
more than a decade.
One we're very proud of.
Yeah,
yes.
Thank you. So, first thing first is realizing India is a big country. And if you see just Uttar Pradesh as a state having the population equal to the population of the UK. So no fun working with 100 kids, 200 kids, 1,000 kids. We also started with 2,500 kids when we started our program a decade back. And now it's almost 30 million kids to whom we reach out to through our program just in India. Nudges are very important, and the power of partnership brokerage is very important. You need to get the right kind of people to work with. It's a mix of public health experts, a lot of decorated doctors were Padam Shris, Padam Vibhushans, and others. Equally, the school teachers. And the best part, what has happened is like the change in the national curriculum framework and how the education policy is shaping up, especially in the schools. Now you have got the things what you can teach in the regional languages more. There is no compulsion to teach the messages in English. There's a big change, like CBSE has attempted now to talk about sugar in the schools. And like very proudly saying like we are one of the partners like who will be taking the messaging, even like, we have no relationship with the sugar industry or something directly. But we talk about hygiene at home, hygiene in neighborhood, personal hygiene, hygiene during illness, oral hygiene, and a lot of other things what we teach.
And it's so important to teach children because they take these messages
Why
home
not?
as well.
And
Yes.
one of my colleagues who's sitting in the audience, she taught me something very interesting, Lois. She told me about self-care. We talk about the preventive healthcare. She said, why not to seed the things in the kids from the lens of the self-care? I asked, like, what's self-care? She said, like, basic things like hand washing. Then she said about diarrhea prevention. Then she said about pneumonia prevention and many other aspects. And what typically happens is there is a big role of healthcare providers. I will not say like there is no role of tertiary healthcare. There's a huge role of tertiary healthcare also. Because the things what tertiary healthcare can do, preventive, I mean, so there's a relationship between the two. And we can't negate like, the top oncologist or the gastroenterologist or, endocrinologist. They are not required. They're equally required because if, like, we still know like with a 1.5 billion population in India, messaging has to reach, nudges have to go, everyone has a different lens of seeing the things. My global experience of working on Ebola, MERS, SARS, polio has taught me one thing is like consistent hammering and consistent messaging is very much required.
And you spoke about schools, but in workplaces as well, that messaging has to go across.
That's the most difficult one because now the workplaces have a lot of Gen Z populations and then they think like they know everything. And there is so much news which is there and to filter the right news is very important. Therefore, the credible sources are very much important. So the big question comes, so who all are the credible sources? It's same like, one fine day a random influencer speaks something about something and people make it as a trend. So, for example, I have three credible voices in this panel.
We at NDTV know all about, this constant fight of ensuring you're the credible voice in this, this world today of a lot of fake news, fake messaging.
So how to filter the credible and the non-credible ones and making sure the credible has a bigger shelf life. So if three of the panelists, if they are talking, if, on the Google trends and searches from the marketing point of view, if they will not be high or if Fortis is a partner, if they have a panel of experts, if they are not at the top and someone random who has no qualification, no degree, speaking on something which is impacting the millions of lives, if those people, so there needs to be a regulation. It needs to be more regulated because it's, largely playing with the people's life.
No, absolutely. Yeah. And when we talk about diabetes, as we were talking earlier, there is a lot of misinformation available there. There's a lot of, cures that are not backed by doctors, and this is something NDTV has done a lot on. But Dr. Leheria, in the beginning, I asked you about how, we're talking about a lot of messaging in urban areas, but it's rural areas really also that we have to reach. As I said, the ticking time bomb, that is diabetes, other, all the other steps they were talking about when it comes to preventive health. So how do we make it reach our villages, our talukas? Do we need to have more community leaders involved? Do you see like the local politicians? How do you see us doing this, getting that messaging across?
I think that's a very important discussion because most of the time we think that this is urban phenomena, the rising burden of non-communicable disease is urban phenomena. That is not completely true. The reason is that, for example, we know that 1 in every 10 adults in India are diabetic. But then this is around 11% of India's adult population is diabetic. But then there is another 14% of India's population is pre-diabetic, which means they do not meet the threshold of having diabetic cutoff, but they are at stage where they can develop diabetes. Now, key thing is that majority of diabetic are in southern part of the country if you look at the map. But in the northern part of the country, there is a big burden of pre-diabetic population. Uttar Pradesh, Rajasthan, Bihar, Madhya Pradesh. This is a rural population. So much of the rural population is currently at threshold of pre-diabetic. If we do not follow current interventions, they would turn into diabetic. So this is a ticking time bomb in a sense. Now, coming to your questions, I think if we remember these aspects, this reminds us that we need to follow both in rural area, urban area approach or life, like making preventive health as a lifestyle approach. Now, often people think what government should do, what community should do, but I personally think that this is, if you want to make a preventive health as a lifestyle way of living, then it has to be at a multiple level, personal. For example, I often tell people that you should be aware about your weight, having a weighing scale in your household, and if you weigh yourself occasionally, then you know whether you are the right weight or not. So how much sugar you are consuming in the daily life, what is your lifestyle pattern. Bringing awareness at personal level will help you adapting preventive
Self-care that Ravi was also talking about. Yes.
Similarly, then family. It's not about the individual alone. If a family is aware that what they are eating, one of the approach which many people advise that at the weekly review of the family, whether they are eating right kind of food, whether they are eating high fat, high salt, high sugar. Do a weekly review of your kitchen in the family, head of the family or a person who is in charge of the kitchen. Do a review that what are the food items which are unhealthy. Take those out. Then the community level be it a workplace, making weighing scale available at the workplace, making people aware about preventive aspect, including schools. So all of those things need to be done. But also I would like to go into, because I do half of my work in policy level, I personally I have had this discussion that whether regulation by the private sector or manufacturer will work. There is a scientific evidence that the self-regulation rarely works. There is no evidence on self-regulation will work. Final point regarding policy. If you want to make this lifestyle approach, personal, family, community, society, government, and private sector, everyone need to play a role. But policy level, for example, we need to have a right levers or nudges. In India, we are hearing a lot about front of package nutritional labels. Indian government is talking about star rating of the food. Even an unhealthy food will get a certain stars. There is a global evidence that it should be front of package nutrition label, which are high salt, high sugar, high fat. So we need to, government also need to decide a policy which will be easy to comprehend. And I can vouch, and there is example for Chile or many other country, that if you do intervention in preventive health in one area, it impacts a wider range of services. So government need to work on all aspects. So if you want to make preventive the lifestyle, follow a life course and across the spectrum approach.
Well, definitely this needs to be done, and we'll have the health minister here shortly, and we can ask her also about this.
Permitted to just add one small point with what Dr. Laheria said. Because there's a lot of pre-diabetes burden in the northern India and across India actually. Simple intervention, if people are aware of natural foods which may prevent progress from pre-diabetic to a diabetic state. For example, nobody knows about that we can have haldi. Our usual,
so haldi was something traditionally one had, and now of course the West is bringing it back with turmeric lattes and whatnot.
Natural yogurt is there. Bathua in North India is there. And
even millets.
Of course, millets would decrease your HbA1c, which is the marker for diabetes, and also decreases cholesterol. Millets is wonder food, actually, I must say that. And add to that, there is a recent research which says that if we can have jackfruit, which will have soluble fiber and would reduce the sugar burden, right? And add to that, very important is the daily exercise. And if people are made aware of that, then only the intervention would succeed, isn't it?
That's right. Ishi Khosa, as you said, there's a lot of messaging out there. I would say, but again, we belong to we belong to Delhi, urban parts. There's a lot of awareness, but clearly a lot more needs to be done, and the right kind of information, be it from schools, be it corporate messaging, or even at workplaces. Earlier also you wanted to add something. Do go ahead.
Yes, I just was very amused because I had an example. Yesterday, a patient of mine came in, and I'm talking about messaging, literacy, and all of that. And he came to me with an elderly man, about 70, and he had a big belly. He's diabetic. So he is very, very, very clued into the sugar aspect. And he begins his day with 5 rusks with a cup of tea. He doesn't put sugar in his tea, but he has 5 rusks. So I said, sir, why don't you begin with a bunch, mixed nuts which are soaked and put some raisins in it. He's looked at me, raisins? Raisins have sugar. So I said, what about the rusk? But they are low sugar, they are not sugary. He doesn't realize that that rusk is going to spike up his sugars, even if he's taking 1, and if he can take 12 or 15 or 2-3 tablespoons of raisins, they won't do that. But that communication needs to be made. Food literacy is what I'm trying to say, is very important. Then in the evening, he was having some biscuits, and I said, why don't you have a fruit at that time? Take a sweet fruit like a mango or whatever. Ma'am, mango is very sugary. I said, yes, but what about the biscuits? Ma'am, those are 0 sugar. But, the 0 sugar biscuits are laced with grains which are going to spike your sugar. So this perception, this food literacy has to be done properly and has to be communicated beyond nutrition. We have to now talk about food groups. Nutrition is one aspect, but we have to talk about people choosing so many servings of fruits, having that half plate rule, very common sense things that, half your plate on your day should be vegetables and fruits and the rest of it in the other food groups. Make it simple for people. Otherwise, the science is standing upside down. We are making wrong choices. Like I said, we're eating fake food because of the kind of messaging that we are doing. And yes, I think a lot of it can also be prevented by addressing gut health, because that's where all the answers lie. What we are eating is impacting our gut microbiome. And that squarely is where everything is decided, whether we are healthy or we are unhealthy, whether we are making the right choices or no. That means our eating behavior. Our eating behavior is being regulated by the microbiome, which is sitting in the gut, which is impacted by the food. So literally in my practice, I see makeovers in a matter of a few weeks. Their food choices change, their palate changes, their appetite changes, because there are 8 appetite controlling hormones in our gut. The neurotransmitters, the happiness hormones, the serotonin, the dopamine, all of these are in the gut. And what we eat is going to determine how these are going to be playing out in our system.
Absolutely, and in the long run, how it affects our health. So clearly, preventive health is something that we need to create a lot more awareness about. There is a lot of knowledge out there, but the correct, information is what needs to go across. Ravi, finally to you. So what sort of, as we're saying, the messaging has to be right, media, and of course NDTV has done a lot of this over the decades in terms of, putting across messaging when it comes to health, especially in all parts of the country. But how can there clearly needs to be more of the same. There needs to be correct information, and people need to realize that, as I said, prevention is better than cure.
Thank you, Gargi, for asking me this question. I'm very happy to answer this because first 15 years of my career was just in public health. And this new hat of corporate communication just came a few years back to me. One interesting bit is when I reflect back on my journey, and that was a time of National AIDS Control Program Phase 2 planning workshops. So West Bengal was first of the states which started with the Buladi campaign. Buladi is an elderly Didi who was giving messages to others, other Didis in the communities in West Bengal on HIV prevention. Second thing, which is not just very much related to the public health, but there was a campaign by Breakthrough called Bell Bajao. It was about the intimate partner violence. So that was a second campaign which just, sticks to me and resonates with me so much because that became super viral. Third thing was by the BBC Media Action Trust. That was a ringtone which was to make sure condoms becomes normal, the normalization of condoms. So it was a condom ringtone, which was there, and that was very big.
Okay.
And last bit, now I'm coming to NDTV and Reckitt. When we started, it was a yearly affair. On 2nd of October, we chose the day, we said, let's do Banega Swachh India, just after Prime Minister launched the campaign from the Red Fort. And over the years, we made sure voices are heard from the community and the right messaging should go. So there are various capsules which are done on each fortnight, what goes out to the people in
And
India.
simple things like just washing your hands.
That's one of the things. Second is, things like maternal health, things like breastfeeding, things like latching, things like growing up for the young kids, things like, prevention of pneumonia or other aspects. So continuously discussions are happening, and we've also seen like there are a lot of places where all the medias can't reach, the mainstream one. Still, India is a country which has a lot of hinterlands. Still, you have a lot of aspirational blocks, more than 500. They need a very different approach, which is, mid-media, or actually reaching out to the media dark areas where, like we went to the Sundarbans, we went to Hingalganj, Pather Pratima, and other places. We even reached out to Jarvas and others through our interventions. So how to actually communicate there? How to take care of the people there? And one is the TV decibel noise. Second is something which is so sticky, which actually happens on ground. One of the examples what I always give is with the Sesame Street, the characters what they have created like Elmo, Raya, Chumki and others.
Yes.
And like how beautiful it is, like the stickiness rates are so high, kids, it's fun for the kids to read about it. And you use various messaging and the media techniques to reach out to the people.
Right,
Yeah,
absolutely.
Thank
There's
you.
a need for that messaging. In fact, you spoke of campaigns. There was that one around Ande, that, Sunday ho ya Monday, rose khao Ande. So I think we need something the opposite of that when it comes to sugar and other items that may be more harmful for your health. But thank you so much all for joining us today to talk about this very important issue. And it's an issue that NDTV will take further along with this campaign, India Health Mission. Thank you all, and a round of applause for the panelists.
Thank you, Gagi and NDTV.
Well, staying with the topic of preventive healthcare.